I think that when you start fellowship, it just seems like such a far way to come. Then one day you wake up and you're like, wow, I really know what I'm doing.
Our fellowship is a combined Hematology and Oncology 3-year program. Part of the way we've tried to design our program, I think, is to be adaptable. It's ultimately up to the fellow to decide what role that they want to do.
We're really lucky to have, the faculty that we do, because I think that they just do this effortlessly. I mean, these are some of the world's experts that are right here, and just to be on rounds with them and talking to them, it's incredible. You're just like a sponge. You're soaking up like so much information at once.
I think the goal of a mentor or an attending is make it possible for your fellow to feel at ease.
When you reach out to an attending to be your mentor, what ends up happening is that you just develop this very close relationship where they really do want what's best for you.
We are very hands-on, so if you love procedures, you have the opportunity to do as much as you want, and the learning never stops in our program.
All of our fellows will have a chance to start taking patients of their own within the first few weeks of their fellowship that they can then follow throughout their entire fellowship, and they are their physician.
We're like front line with patient care. You get to come up with, okay, well, how do I want to approach this? What is the best treatment for them?
Our mission remains the same for all of us. We want to eradicate cancer from Earth. And I think the ability for us to make an impact in patients' life and their families is something that we all actually work for every day.
The fellows here rotate through the main campus at University Hospitals, Metro Health, and the VA hospital here in Cleveland. They see 3 completely different health systems in different areas of town with different patient populations and different levels of acuity.
Main campus is very much your traditional academic center where everyone's very much subspecialized and you get really, really specific training on really specific different types of cancers, and that's great.
The VA is a fellow-run clinic. These are all the fellows' patients. They see the patient, they make the diagnosis, they make a treatment plan, and we're here to support the fellows, which is something that's very unique about the VA, and it's incredibly rewarding. The patients are very unique in that they are very medically complex. And they're veterans. They've served our country. They dedicated their lives to our country.
Metro Health, being a county hospital, sees everyone, which is a very good thing because you don't just see the rich or the poor, you have a mixture, and that's exactly how medicine should be. That's the taste that Metro Health gives to our fellows. We see patients from early stage and really late stages, and so it prepares the fellows to be ready for life when they graduate.
We've tried to structure our rotations such that all fellows will complete their core clinical requirements by the time they're 2 years into fellowship, and a majority of their 3rd year can actually be spent becoming the subspecialist that they want to become.
Your destiny is in your hands. You have to actually decide how hungry you are and what you really want to accomplish, and we will be there to put the pieces of the puzzle to be able to actually engage and embrace whatever interest you have so we can make you successful as you come out into practice.
We need a fellow who is ready to see everyone without discrimination, ready to work in a county hospital.
Be yourself. Let your passion show. We're always looking for genuine people who are really passionate about their job, passionate about patient care.
You're truly meeting people at the most vulnerable part of their lives, and they're putting their lives in your hands. I would treat my mother the same way I would treat anyone else. I think that's the thing that we're looking for in applicants and people, is that we're trying to find people that are going to do that.
You feel like if I spend more time with a patient, I may not have as many patients as I am needed to. We need to go past that and take care of the patient and not just a number.
I love this fellowship. I love this hospital. I really think that it really makes you into a good doctor.